gentleman in our Cambodian focus group had a friend who lived in, actually not in California, but in Rhode Island. And he had a business. I believe, was a donut shop in Rhode Island. But he liked to go to the car clubs every night. One night he decided to take his wife, pregnant wife, with him. And he had just lost a whole lot of money that night. And on the way back, he was so distraught and how he's going to keep his business open after losing all this money. They got into a head-on collision with a truck. And unfortunately, the wife and the unborn child passed away in that accident.
But what we do want to do is to help people identify that somebody may be suffering from a serious mental illness. We don't want them to come up with a DSM diagnosis for us. And so what we've done is we've added this other song by Rubén Blades, Sebastián, and it has hallucinations, has delusions. And so we play that, and after going through the clave, we ask them to use the clave to see if this person, Sebastián is the name of the person, may suffer from serious mental illness. And it turns out he has creencias falsas, false beliefs, delusions, and he also perhaps hears voices and perhaps sees things. So it's actually not just learning la clave, but applying it. And we think that that has a greater possibility of being effective. We have the list of the clave and what they mean, and then we have a directory of services. We've done beforehand an assessment of the services that are available in the community, and so that people can know where they can get services. And it includes outpatient facilities, some private clinicians, and also emergency, including ER of all of you, mental health.
So this is a partnered project between academic partners and community organizations and community members. And as a partnered project, we're following Healthy African American Families community engagement model. And that really means that academic and community partners in this project are on equal footing. We have different areas of expertise, but that doesn't make one of us more of an overall authority than the other. And I think that that has been one of the most exciting and capacity building aspects of this project, not only for the participants, but the communities that we're trying to serve through this project.
First of all, depression is one of the leading causes of morbidity and health disability worldwide, and only 1 in 4 Americans gets treatment. And the number is even less for African Americans. But the thing is, when African Americans do get treatment for depression, they have better outcomes than whites do, and both groups experience economic growth. In the beginning, most of the community members, myself included, we were really quiet. We didn't speak up. We just came to the meetings. I, in particular, was, I was like sitting next to Dr. Wells, and it's like, he's got all these letters behind his name. He knows this. He's got the suit and tie. I didn't have anything to say that he wanted to hear. And then I found out that, yes, I did. And once the community found out that, we did have valid input into the project, we began to speak up. And we just became more engaged in the process. And now we have community members. For example, in August of 2005, we participated in the African American Marketplace. We did surveys. We came up with, I think, 1,582 surveys. We're getting ready to do the data analysis for that project. In 2004, Talking Waters participated in the Pan-African Film Festival. We did surveys there also. And throughout 2005, I myself participated in the data analysis, which is something you couldn't have told me I would have been doing 2 years ago. And I learned a lot. I'm still learning a lot.
Knowledge is just fascinating to see how each pushes the other to rethink their original formulations about the problem, to rethink their approaches to the problem. So the academics are being forced to rethink, and I think the community has things open to them that allow them to rethink how they do their work. And I think this is exactly what we mean when we talk about academic community partnership.